Hello people, in this video let us look at this prep manual for undergraduates. Some selective anatomy they are saying. Looks like something to help you pass very easily. Let's see. This is volume 1 and this one here is volume 2 by Vishram Singh. What are they achieving this? Thorough revision of all the chapters. So looks like volume 1 covers upper limb, head and neck, brain, general anatomy, general histology. First let's look at this book. So it has some diagrams and quick points. So the origin of the muscle, the insertion, the nerve supply, actions of the muscle. In the hand, they are covering this is the aponeurosis, right? Palmar aponeurosis. Palmar aponeurosis is coming from where? It is coming from this tendon of palmaris longus. That itself, when the tendon is flattened, it becomes aponeurosis. So it is question answer type. Describe the palmar aponeurosis briefly and discuss its applied anatomy. So question answer type, so looks like it will help. So this is the Dupuytren's contracture. Where and why does it happen? The reason. Did they tell you the reason? Enumerate the intrinsic muscles of the hand. So these are all the muscles of the hand. Let us see if they gave a diagram for this. Not exactly, right? Not all the muscles they have given, but at least a question answer type looks like. All important questions at least to pass. What do you think this is? Just by looking at this, don't look at the label down. You can see that there is some colloid inside, right? This looks like thyroid to me. Yes. In fact, the same diagram is there in their main textbook also. Vertebra here. What do you think they're trying to tell you here? Atlanto-occipital and atlanto-axial joints. So what is the clinical importance of this? You should know the clinical importance, right? Why they are asking. Why do I feel it has got something to do with the hanging, the judicial hanging? I think this is affected, this joint. You'll have to look at that. They have not given the clinical importance here. Oral cavity. See, one thing is you can very quickly cover chapters in this, including general anatomy, right? Not sure how useful it is. So they are covering some neuroanatomy also in this. And then general anatomy is coming at the end, interestingly. So looks like this textbook has been used and read by people. So a quick question answer type always is favorite of students, isn't it? So this is volume 1 covering your general anatomy and head and neck upper limb. Now let's look at the volume 2. Volume 2 obviously will cover the abdomen and lower limb, and it's covering thorax also. Okay. So your heart, everything will come here. So similarly, let's look at this book. What do you think you're seeing here? This is the manubrium sterni. So that is that bone that you feel for the notch, right? So the interventricular septum is here, bulbar part, membranous part and muscular part. So based on this, you know, all those VSTs, ventricular septal defects, you should know which place of the septum is it more common, right? So the clinical correlation should be telling you that. So this diagram is the anal canal and its sphincter, right? An extracapsular fracture of the neck. So there's a fracture here. So if this is the neck, there's a fracture here, okay? And at the end of everything, what they have given, nothing special. Question, answer, question, answer. Applied anatomy is very important if you want to pass the subject. At the end of every question, though they haven't asked you to write the clinical importance. This is the femoral triangle, very important to know. Very easy, no? It is, what you have is femoral artery, femoral nerve, femoral vein. Simple, no? Everything is femoral only. At least that much you'll get marks. And what do you see? This is Trendelenburg sign. So you see when the person is standing on one of his legs, sagging of the pelvis on the healthy side when the foot of that side is off the ground. So this is the healthy side, which is sagging. Okay. So what else do you want us to cover in this book? So Volume 1 and Volume 2, Selective Anatomy Prep Manual for Undergraduates by Vishram Singh. This is a review, just to have a question answer format for the exam with diagrams. This book looks concise, so make your decision. Bye bye.